of at least 100 compressions per minute. Pushing hard when giving compressions is just as important with infants as with adults. Make sure the infant is lying on his back on a firm, flat surface. If possible, use a surface above the ground. Move clothes out of the way. Put 2 fingers of one hand on the breastbone just below the nipple line. Press the infant's chest straight down about 1.5 inches. After each compression, let the chest come back up to its normal position. This lets blood flow back into the chest. You'll need to give compressions at the rate of at least 100 per minute. So let's practice giving compressions for an infant. We're going to pause the video now to allow you to get into position to practice. As with adult CPR, you'll be doing more compressions in a row for this practice than you would for a regular sequence of infant CPR. Again, whoever is last each time can stay in position when finished, since you'll be the first one to go the next time. For this practice, you should be standing next to where the mannequin is lying. Watch the video as you practice. You should already be standing next to the infant mannequin, which should be lying on a firm, flat surface, above the ground if possible. Get ready and begin. Move any clothing out of the way of the chest. Put 2 fingers of one hand on the breastbone just below the nipple line. When I tell you, keep time with the beat, pushing straight down on the infant's chest. Remember to push hard and push fast. After each compression, let the chest come back up to its normal position. Get ready and begin. Push hard and fast. As you keep time with the beat, you are pushing at the rate of at least 100 compressions a minute. When you push, make sure the mannequin's chest moves down about 1.5 inches with every compression. After each compression, let the chest come back up to its normal position. Keep pushing until the drum beat stops. Even on an infant, the first compressions are the most effective overall, and they become less effective as you go. If someone else knows CPR, take turns by switching at least every 2 minutes, even if you're not tired. This will help make sure your CPR is effective. Move quickly to keep the pause in compressions as short as possible. Remind each other to push down about 1.5 inches at a rate of at least 100 compressions per minute, and to let the chest come back up to its normal position after each compression. Infants often have healthy hearts. Usually, when an infant's heart stops beating, it's because she can't breathe or has trouble breathing. Therefore, it's very important to give breaths as well as compressions to an infant who needs CPR. Just as in adult CPR, opening the airway correctly will help keep an infant's tongue out of the way to make sure your breaths are effective. Opening the infant's airway too far can actually close the infant's airway, making it difficult to get air inside. Follow the techniques you're about to learn to make sure you open the infant's airway correctly. Sometimes you'll find that your breaths aren't making the infant's chest rise. If you give a breath and the chest doesn't rise, quickly reopen the airway by allowing the head to go back to the normal position, and then open the airway again. Give another breath and make sure the chest rises this time, interrupting compressions for no more than 10 seconds total. If the chest doesn't rise, begin pushing hard and pushing fast on the chest again. So let's look at the steps for opening the airway and giving breaths to an infant. And remember, this should be done quickly during CPR, never interrupting chest compressions for more than 10 seconds. We'll show you how first, then you'll get a chance to practice. Begin with 2 fingers of one hand on the mannequin's chest, since you will always be giving breaths after compressions. You don't have to actually push on the chest right now. To open the airway, follow these steps. Tilt the infant's head by pushing back on the forehead, and put the fingers of your other hand on the bony part of the chin and lift. It's important to avoid pressing into the soft part of the neck or under the chin, because this might block the airway. Also, don't push the head back too far, or this might close the airway as well. While holding the airway open, take a normal breath. Cover the infant's mouth and nose with your mouth. Give 2 breaths. Blow for 1 second each. As you give each breath, you should look down at the infant's chest to see it rise. Infants don't need as much air to make the chest rise, but you'll only know the infant has gotten enough air if you do see the chest rise. After giving the breath, go back to the position to give compressions. Let's watch one more time. Tilt the infant's head by pushing back on the forehead, and put the fingers of your other hand on the bony part of the chin and lift. While holding the airway open, take a normal breath. Cover the infant's mouth and nose with your mouth. Give 2 breaths. Blow for 1 second each. Watch for the chest to rise. After giving the breath, go back to the position to give compressions. Now it's your turn to practice opening the airway and giving breaths to an infant mannequin, along with the video. Whoever went last before will go first this time. For this practice, you'll try 3 sets of 2 breaths, and start and end each time with your fingers on the mannequin's chest. The first set will go a little slower, but the second 2 should be normal speed. You should already be in position, so get ready and begin. Begin with 2 fingers of one hand on the mannequin's chest. Move to open the airway. Tilt the infant's head by pushing back on the forehead, and put the fingers of your other hand on the bony part of the chin and lift. While holding the airway open, take a normal breath. Cover the infant's mouth and nose with your mouth. Give a breath for 1 second. Give a second breath, blowing for 1 second. Again, watch for the chest to rise. Go back to the compressions position. Okay? Try again. Open the airway. Give a breath. Give a breath. Okay, try again. Open the airway. Give a breath. Give a breath. Remember, if you give a breath and the chest doesn't rise, quickly allow the head to go back to the normal position, and then open the airway again. Give another breath. If the chest doesn't rise, begin pushing hard and pushing fast on the chest again. Okay, now let's try combining compressions and giving breaths. We're going to practice along with the video, just like we did before. This time, however, we're going to do sets of 30 compressions and 2 breaths. This is the ratio you'll use to give effective CPR. Remember to push straight down about 1.5 inches at a rate of at least 100 compressions per minute. Push hard and push fast. After each compression, let the chest come back up to its normal position. When giving breaths, watch to see that your breaths make the chest rise. We'll start standing next to the mannequin, with your fingers in place to give compressions. Get ready and begin. Now, open the airway and give 2 breaths. Repeat. Now that you know how to give infant CPR, let's talk about knowing when to give it. If an infant doesn't respond and isn't breathing or is only gasping, you need to give CPR. If you're not sure, go ahead and do CPR. An injury is unlikely, but it is better than death. First, make sure the scene is safe.
The scene is safe.
Next, you need to check to see if the infant responds. Tap the infant's foot and shout,
Baby, baby, are you okay? Baby.
If the infant does not move, make a sound, blink, or otherwise react, then he is not responding.
Help! Somebody help! You, go call 911.
When the infant does not respond, you need to check his breathing. Do this for at least 5 seconds, but no more than 10 seconds. If he is not breathing or is only gasping, then he needs CPR. Infants can often have breathing problems for some time before you realize it. For this reason, if you are alone when you find an infant who doesn't respond and isn't breathing or is only gasping, you should immediately give 5 sets of 30 compressions and 2 breaths. Then you can go call your emergency response number. Okay, now let's see what it looks like when you combine everything you've learned together. We're going to show you a demonstration of infant CPR. Pay close attention because you'll get a chance to practice afterwards. If you find an infant who may be ill or injured, first, check to be sure the scene is safe.
The scene is safe.
Make sure the infant is lying on his back on a firm, flat surface. If possible, use a surface above the ground. Tap the infant's foot and shout to see if the infant responds.
Baby, baby.
If not, then yell for help.
Help! Somebody help!
Check for breathing for at least 5 seconds, but no more than 10 seconds. If the infant isn't breathing or is only gasping, move clothes out of the way and give 5 sets of 30 compressions and 2 breaths. Now, open the airway and give 2 breaths. Watch for the chest to rise. Repeat. Repeat. You'll need to keep giving sets of 30 compressions and 2 breaths until the infant starts to breathe or move, or someone with more advanced training takes over. After the 5th set of compressions and breaths, if no one has come to help, then go call your emergency response number or 911. Continue CPR while you wait for someone with more advanced training to arrive. And that's what infant CPR looks like. Again, the first compressions are the most effective overall, and they become less effective as you go. So remember, if another trained person is present, switch rescuers at least every 2 minutes, even if you're not tired, to make sure you're giving good CPR. And remember to give feedback to the other rescuer while you are resting to help make sure they push hard and fast. Congratulations! You've just learned CPR for infants. Here's your chance to practice everything together. The following scenes will show a variety of emergencies. It will be up to you to take turns showing how you would respond to them. Your instructor will guide you, and after everyone is done practicing, you will each be tested on your infant CPR skills.
You and a friend are babysitting her niece. You hear her call for help. When you arrive, she says something is wrong. You are visiting a friend and hear her yell for help. When you arrive, she tells you her baby's breathing is not normal. You find the baby in the crib. You are alone and babysitting a friend's baby. When you go check on him, he doesn't appear to be moving.
A common emergency with infants is choking because of food or some other object being stuck in the airway. Some choking is mild and some is severe. When an infant has severe choking, you must act quickly. You'll use a combination of back slaps and chest thrusts to help remove the object blocking the airway. Each thrust pushes air from the lungs like a cough. This can help remove an object blocking the airway. Use the following to find out if an infant has mild or severe choking and what you should do. If an infant can make sounds or cough loudly, then the choking is probably mild. You should be able to stand by and let her cough. But if you're worried about her breathing, call your emergency response number or 911. If an infant cannot breathe or has a cough that has no sound or cannot make a sound at all, the choking is severe. Act quickly by doing the following. Hold the infant face down on your forearm. Support the infant's head and jaw with your hand. Give up to 5 back slaps with the heel of your other hand between the infant's shoulder blades. If the object does not come out after 5 back slaps, turn the infant onto her back, supporting her head. Give up to 5 chest thrusts using 2 fingers of your other hand to push on the chest in the same place you push during CPR. Repeat giving 5 back slaps and 5 chest thrusts until the infant can breathe, cough, or cry, or until she stops responding. Any infant who has been given back slaps and chest thrusts should be seen by a healthcare provider. If you give an infant back slaps and chest thrusts and the object still doesn't come out, the infant will stop responding. Pushing on her chest may force the object out. Lower the infant onto a firm, flat surface. Then tap
Baby.
and shout.
Baby, are you okay?
If the infant doesn't respond, then yell for help.
Somebody help me!
Check for breathing. Immediately push on the chest 30 times. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. Give 2 breaths. Repeat giving sets of 30 compressions and 2 breaths, checking the mouth for objects after each set of compressions. After 5 sets of compressions and 2 breaths, if no one has come to help, then call your emergency response number or 911. Give only chest thrusts and back slaps to an infant. Giving thrusts to the abdomen of an infant could cause serious harm. Give sets of 30 compressions and 2 breaths, checking the mouth for objects after each set of compressions until the infant starts to respond or until someone with more advanced training takes over. If someone is with you when you find the infant, send that person to go call your emergency response number or 911 while you stay with the infant. Your job or workplace may require you to use a mask when giving CPR to an infant. Masks for infants are made the same way as those for adults, only smaller, to fit over the infant's mouth and nose. Make sure you're using the right size for the infant. Now we're going to practice giving breaths to an infant using a mask. The video will now pause to allow you to assemble your mask and get into place to practice. You're going to practice giving breaths like before. Follow along with the video, making sure to watch for the chest to rise as you give breaths. Start out standing next to the infant mannequin with your fingers on the chest. Get ready and begin. Put the mask over the infant's mouth and nose. If the mask isn't round, put the narrow part of the mask on the bridge of the nose. The wide part of the mask should cover the infant's mouth. Tilt the head and lift the chin while pressing the mask against the infant's face. It's important to make a good seal between the infant's face and the mask while you lift the chin to keep the airway open. Remember not to open the airway too far. Now that you've got the mask positioned, give 2 breaths while watching for chest rise. As you give each breath, you should look down at the infant's chest to see it rise. Actually seeing the chest begin to rise is the best way to know that your breaths are effective. After giving the breath, set the mask down next to the mannequin's head and go back to the position to give compressions. Let's try again. Give another breath and watch to make sure the chest rises. If you give a breath and the chest doesn't rise, you need to reopen the airway and reposition the mask to get a better seal. Give another breath and make sure the chest rises this time, interrupting compressions for no more than 10 seconds total. If the chest doesn't rise, begin pushing hard and pushing fast on the chest again. Let's try one last time. Place the mask and open the airway, making sure to get a good seal. Give 2 breaths. Blow for 1 second each. Watch for the chest to rise each time. After giving the breath, go back to the position to give compressions. Congratulations! This concludes the infant CPR module of the video. Let's review what you have learned. You've learned the most important part of infant CPR, how to give effective compressions, pushing down about 1.5 inches at a rate of at least 100 per minute, and to let the chest come back up to normal after every compression. You've also learned how to give breaths quickly and effectively without interrupting compressions for more than 10 seconds. You've learned that it's important to open an infant's airway properly so it doesn't open too far. You've learned how to assess the emergency and call for help, and to give CPR first if you're alone and find an infant who needs CPR. And